In today's video on comments on psych meds by Psychiatrist, I am staying in the same category as last week, and I'm going to talk about Ativan, or generic lorazepam. It's another in the class of medications known as benzodiazepines, which are a controlled substance because they can lead to physical dependence if used on a regular basis. And for this reason, they should be carefully monitored by somebody trained in prescribing benzodiazepines. That being said, Ativan is an excellent medication for short-term use for the treatment of severe anxiety. And some people find Ativan quite sedating and helpful for sleep, although, as I've indicated before in other videos on benzodiazepines, I prefer to use other agents to help with sleep just because of the risks of dependence and tolerance with benzodiazepines. So Ativan comes in 0.5, 1 milligram, and 2 milligram tablets. Usually I start out at a half a milligram, but we'll fairly regularly move on to 1 milligram doses, again, depending on the patient and what is effective. One use of Ativan that is somewhat common amongst some of my patients is patients who have, for example, a fear of flying will often use a benzodiazepine like Ativan to help them stay calm. They usually take a dose as they're on their way to the airport. As I mentioned before, Ativan can make you sleepy, so you have to kind of balance getting sedated before the flight, before you're settling into your seat. But you do want to take it generally in advance of the flight because it does take a little while to fully kick in. And the other uses are for panic attacks and other acute anxiety, and as I said earlier, for sleep. Coming off of Ativan, if it's used occasionally, for example, for a flight, it's generally no issue. If you have been using it on a daily basis for weeks at a time, then you have to gradually reduce the dose. Otherwise, you'll get rebound anxiety, or in certain cases, you can actually trigger a seizure. So it should not be stopped suddenly. When you're first starting to take Ativan, you definitely want to be cautious because it is sedating. It can slow reaction times, and you definitely want to have a strong sense of how Ativan affects you before driving and other activities that require hand-eye coordination. But overall, benzodiazepines in general and Ativan in particular can be a very useful medication, in particular for acute anxiety, and just has to be monitored appropriately. Okay, thank you.